So almost immediately, even though I hadn't yet started chemo, but I knew that I wasn't going to be able to have a really good physical relationship with my husband for however long I was in treatment. When we tried to have intercourse, it was extremely painful and it hurt in so much. It was like something I'd never thought that I would ever experience. And from that moment, and it was the first month that I'd been diagnosed, I realized that something was massively wrong and nobody wanted to talk to me about it unless it had to do with my fertility.
There were no explicit discussions with my healthcare provider about how to prepare and cope with the side effects that would come along with my treatment as it related to my sexual health and intimacy.
I was a young, single woman. One of the first thoughts that I had when I started treatment, I was like, how am I supposed to date? How am I supposed to be sexually active? When it hit me, it was really confusing and concerning because it was such severe symptoms. And yes, I was going through treatment, I wasn't totally surprised, but some sort of warning would have been nice.
I didn't realize till I went to the doctor, and I was my doctor's first really, really young patient. So I kind of struck a chord on him. He treats me like really specially, and he's always like informing me, and he has like a really open relationship with me. And I think that is like bittersweet, because it's kind of like a privilege that not a lot of women have. He was the one that realized that I had dryness, and then he started asking me all these questions like, how is your sexual life? Does intercourse hurt? Like, how are you're feeling with like your sexual desire and stuff like that? And that's when I realized that there was something wrong and it wasn't just me.
It took me about a year before I realized that it wasn't just me, that there are women everywhere that are suffering with sexual side effects of their breast cancer medications, and nobody has talked to them about it. And I think it's a main thing where it's a side effect that doctors aren't comfortable talking about, or they don't think to talk about because they're too busy saving the person's life. And while I understand that, there's also a quality of life that needs to be brought into account.
I think the misconception is that, they're not thinking about this because they got to think about the cancer part of it. And, I wasn't so concerned about the cancer treatment part of it because I feel like it's a treatment plan. There is a plan. And so we're just going to try it out and go from there. And if they would have initiated the conversation earlier, I probably could have been doing a lot of the preventative therapies. Maybe my tissue wouldn't have dried out so fast. I don't think it hurts to bring it up. You could just be like, hey, this side effects is going to affect your sexual health. Do you have any concerns about that? I have resources. If you're not ready to talk about it now, it's okay. But when you're ready, I'm here. I got you. And that's it. And just leave it at that. That way we are aware, and it puts that seed in our brain to kind of, okay, now I know I could, do something about it instead of just suffer through it.
I wish that my provider had brought up what was to come in terms of my sexual side effects so that we could have then come up with a plan. And if they weren't the expert to deal with that, refer me to someone that is. But waiting for the patient to discover what's going to happen to their body leads to these feelings of shame and guilt, versus if I know this is an understandable side effect that's going to come and here are the resources should this happen to you, I would feel much more prepared and empowered for how to take on this aspect of my treatment and my long-term side effects. So I would beg providers to have these sometimes awkward and difficult conversations with their patients about sexual side effects and how to focus on their intimacy and sexuality while navigating breast cancer.